Here we're talking about fairy tales and folk tales and personal stories and family tales and even a little music from time to time. And each story could spark a memory for you that you can share with the people that you love. Hear the Appleseed every Thursday at noon, right here on the information and cultural beacon of the Four Corners, KSJE, Farmington, New Mexico.
KSJE is supported by San Juan Regional Medical Center, a community-owned and operated hospital, here for you when you need us. From emergency care to routine checkups and screenings, caregivers are here and ready to provide the safe, high-quality care you need close to home. Online at sanjuanregional.com with the latest health information and resources to help you live life better here. KSJE is supported by the Farmington Civic Center, bringing a full slate of entertainment to Farmington and San Juan County. The Queen's Cartoonists, Tuesday, February 8th at 7:30 p.m. The Farmington Civic Center, 200 West Arrington in downtown Farmington. Find out more online at fmtn.org/shows or at 505-599-1148.
Good morning, everyone. I'm Megan Cullup, along here with Scott Michlin.
Well, good morning.
Morning.
You're not Candace, though.
Oh,
Says
no.
you are.
Candace Christel.
Crystal, yeah.
Crystal?
That's my next guest this
Oh,
morning.
okay.
He'll be talking
Sorry,
about
guys.
the night to shine.
That I'm not Candace.
And I don't know why that wasn't fixed, but
Everybody was excited.
yeah.
They're like, oh, Candace.
Oh, there you go.
That's not me.
I don't know what I did and why that didn't work, but anyway, we'll fix it. How
Technical
about-
difficulties.
Yeah, there you go. How about that? Much
It hasn't
better.
happened in a while. I mean, it never happens to your name, but it hasn't happened to my name in a while.
Yes, because my name never changes, unfortunately. But anyway, there we are. Now we're good.
Okay.
My apologies, everybody. Good morning. It's Friday, the 4th of February,
4th.
right?
That's
and
right.
Here we go. Groundhog has seen a shadow this week.
6 more weeks.
Darn rodent.
Jeez, I know.
You know?
Somebody should have taken them out before that.
That's right.
Yeah.
But anyway, here we are. So.
Oh.
It's good to have everyone with us. This is our COVID-19 Community Information Program, and so we're going to be sharing a lot of information for you today. Our guest, Dr. Bob Underwood from San Juan Regional Medical Center, will be joining us momentarily. He's actually standing by. He's in what we call the telephone green room.
Yes.
Yes, just relaxing.
He doesn't have any
Enjoying
snacks
some-
in there, though.
He might, but we didn't get him
We
any.
didn't provide him
We
any.
didn't, no. But he is standing by. So he'll be here in a minute. But before we get to Dr. Underwood, I did want to share the latest news about cases here in San Juan County, because as you know, we've been showing those every 2 weeks when we visit about COVID-19. So let's take a look and see where things are at from the Department of Health. So this was 2 weeks ago, the last time we were with everybody on the show, and we saw the big case number increase there from, I would assume, the Omicron variant, but it was probably some of Delta as well, right?
Right.
So, and you can see kind of the surges that we've had here in San Juan County all the way going back to March of 2020. Mm-hmm. And so as we go to the most latest 7-day rolling averages, and the numbers are dropping pretty dramatically.
Pretty dramatically. This
So-
is exciting to see.
Yeah, we are glad to see. I mean, we're down to 200 average cases a day, which is still high
Right.
for San Juan County, but down from the peak of above 400 cases a day.
Right.
And so that is, I think, good news, heading in the right direction.
Yes.
So anyway, so let's see if what that means
That
for the
trend
hospital.
continues,
Yeah,
yes.
and what that means for the hospital. So we'll bring on our guest, Dr. Bob Underwood, Chief Medical Officer, San Juan Regional Medical Center, who is joining us on the phone this morning. Dr. Underwood, good morning.
Good morning, Scott, and good morning, Megan. How are you?
Hey, doing well. How are you?
Good.
So we're just showing these weekly 7-day rolling average COVID cases for San Juan County, Dr. Underwood, and it showed that it seems like the peak of cases has declined, and we're hoping that means that the hospital is not seeing as big of a patient caseload as you once were from some of your last visits with us.
Definitely down from where we had been. We are not seeing, in terms of the Omicron surge, which you all were just speaking of, we're not seeing that decrease yet in the hospital. As we've spoken before, often what we see in our community will precede what we see in the hospital by 2 weeks, maybe 3 weeks, kind of depending. And so as of this morning, we had 54 positive COVID cases in the hospital, which is way down from where we were in our last big surge, which really kind of goes back to last Thanksgiving time frame, where we had nearly 100 COVID patients in-house. But 54 as of this morning, and that number has actually been just slightly climbing for the last week. We do anticipate that the numbers in the hospital will start going down within the next week or so, reflecting what we're seeing in our community.
Very good. And so with that conversation on how many folks are in the hospital with COVID, et cetera, the last time, I mean, it was a couple months ago now, we were discussing sort of converting these floors as COVID floors that were previously, I don't know, cardiology or some other specified floor. Do we still have these floor conversions going on? Has that reverted back to normalcy? Where's that at?
We're in the process of we're still under what we call crisis standards of care. And we are in the process of looking at the thresholds, which would convert us back out. I don't know. We declare crisis standards of care. I don't know if undeclare is a word, but that's what we're looking at, is at what point do we hit thresholds where we can go back to not being in crisis standards of care. At the time that we spoke, we actually had turned our cardiology floor into another critical care unit, an ICU. And we do not have any ICU patients outside of either our ICU or our step down from the ICU. We have 2 critical care patients in that location right now, for actually a total of 12 critical care patients, which is way down from our peak of 37 critical care patients when we could not transfer out. That was, again, end of November timeframe. So I would say, to answer your question, it is a transition that is underway but not yet complete, to try to return patient levels to the, I don't want to say appropriate floor, but kind of better aligned to where we were previously in the pre-big surge time frame.
Got it. And Dr. Underwood, you kind of were alluding to the other hospitals and transfers in and transfers out of critical care patients and things like that. What's the story at the other hospitals in our state? I know you're in contact pretty regularly with other medical officials across the state. Are they seeing the same level of cases like San Juan Regional is, or are there other parts of the state faring better, faring worse? How do things look around the state?
Still busy, but the ability to transfer patients is much better and much more like it used to be in terms of the normal patterns. For a while, we were so full we weren't accepting patients in transfer from even our local hospitals, either down in Gallup or Northern Navajo Medical Center out in Shiprock. All of those patterns of referrals have kind of returned to normal, which has been great for us. The same thing with us being able to transfer out for specialties that we don't take care of at this particular hospital, which isn't very many, but occasionally we do need to transfer a patient out. And you're right, at one time we were calling multiple states trying to find a hospital that had an open bed. That is not the issue that we're seeing anymore, which is really a great benefit. Great for our patients and also great for our staff in being able to expedite those transfers.
Yeah, that's huge. And so I have a question about length of stays and stuff. So Omicron is, there was a surge, people catch it, whatever, and then say they go to the ER. I mean, I kind of have a twofold question. One is, how much do we think these ER visits are more related to maybe people just not having a primary care physician to go to when they're sick? I mean, maybe we know that happens in other cases. And then the second question is, how many of those ER visits really translate to overnight visits? So I guess trying to tease apart really what's happening here relative to other sicknesses.
So yes, to your earlier question, and that's kind of the way it's been for lots of illnesses. I'm an emergency physician by training and worked in emergency departments since I finished my residency, which was a long time ago, and we won't talk about that. But nonetheless, a lot of what we see in the emergency department is, in fact, what you're talking about, is those patients that don't have a primary care physician, and they come to get primary care or what would have otherwise been a screening that could have been done in a primary care office. So, yes, we are seeing a number of folks either out at our urgent care center or in our emergency department that are really just coming in for testing. And so we've been trying to encourage our public that there are other opportunities and other places where testing can be done, and they don't need to come to the ER for that level of test. And, of course, the federal government is helping out with that, state is helping out with that with home tests, et cetera. So that's really been a benefit across our organization and across our community. Now, in terms of number of patients who are positive who actually end up in-house, it is consistent with the news that we've been hearing about Omicron, and that is, it is not as severe. Does that mean there's no patients who get admitted or no patients who end up in the ICU? No, that's not the case. However, it is proportionally significantly lower than what we were seeing with the Delta variant, for example, just a few months ago. So for most people, it is an infection that is like the flu, cold, or something like that, but there are a few that do end up in the hospital because of the Omicron variant of COVID.
Got it. And Dr. Underwood, can you give us the breakdown between vaccinated and unvaccinated patients that are currently at San Juan Regional Medical Center with some form of COVID-19? Is that something, I think it is something you folks track, isn't it?
Yes, it is. It's something that we're still tracking on a regular basis, and the statistics still hold true. The vaccine is very protective, especially against hospitalization, ICU care, and death. So the data, it's not, and there's a couple of components that are this. We know that the immunity from the vaccine starts to wane after a period of time. So what we're seeing is, at one time we were seeing numbers that were less than 10% or 10 to 15% of the patients who were being admitted to the hospital were vaccinated, and everybody else was not vaccinated. That number shifted up to 25% or so are vaccinated. But remember, the majority of our community is indeed vaccinated, but the majority of our admissions are unvaccinated. So statistically, significantly better if you are vaccinated to prevent admission to the hospital and infection, and especially death.
Yes, great reminder for us all. And we have one more follow-up question about crisis standards of care. What are the requirements to begin to lift that? What needs to happen?
So it really has to do mostly with staffing. What beds do we have available? What nursing staff do we have available? As you all know, we've had some federal resources that have been here for some time, both from the Department of Defense that have had some teams that are here. The last Department of Defense team will be leaving today. And so that's going to put us back into our own contingent of staffing, and we want to see how that is really affecting the care and the time that we have to care for the patients. That will be a big component of it, is what are our staffing levels and staffing capacity. That's probably the biggest piece, to tell you the truth, that we want to make sure that we have the ability to provide that level of care with our own team before we determine that we're not in crisis standards of care. The state, when they released the public health order around that, left it up to individual hospitals to declare whether they were in crisis or whether they were not. And so we have the criteria. It really is just a question of, are we overwhelmed? Is our system and our ability to take care of patients put us in a position where we're not able to provide the standard of care, those key words, that we would do under normal circumstances? So that is the threshold. Of course, we look at our OR staffing, the operating room. We are returning that. For a while, we were decreasing the number of surgeries that could be performed, especially any surgery that would require an overnight stay or more in the hospital because of our ability to staff the beds. And so we, on Monday, will be reopening our operating room for more of the elective type cases than we have been doing. And so those are some of the steps that will put us on the track to become not crisis standards of care again.
Very good. Very good. Well, that's important. And I guess, too, Dr. Underwood, you're trying to maybe predict, too, what the virus is going to do. And you don't want to come off of crisis standards of care if there's another surge, God forbid, that could be happening in a couple of weeks, right?
Absolutely. I think that a lot of people have heard of the Omicron variant, even that there's a sub-genetic profile of the BA1 is the one that's out in Africa. There's especially a surge of the BA2 version of Omicron. The question is, there's lots of questions about, protective of having been infected, how close behind Omicron BA1 does BA2 come, and will it cause a secondary surge? Will it not cause a surge at all, but cause a slower decrease than what we thought we were going to see? The original reports of Omicron was that there's a rapid increase and then a rapid decrease. So we don't know. And as you guys also are very aware, we've been trying to predict this for 2 years, and we've gotten it wrong quite a lot in terms of what we're going to see for the next round. We just don't know. And so exactly what you said, we want to be prepared, and we don't want to de-escalate our status or our preparedness only to have to rebuild it all back up. So that is absolutely a key component in terms of our overall status as a hospital.
Well, Dr. Underwood, thank you as always for coming on. It's so nice of you to share your time. We appreciate in all the crazy news cycles to get some clarity here, especially locally, and so thanks again for coming on.
Love to be here, and any time. We like to be able to share what's actually happening with the public. There's a lot of misinformation, and so thank you for giving us the ability to talk to the public. We really do appreciate it.
Well, thank you again. We appreciate everyone, and of course the staff at the hospital, and we know you've been through a lot the last 2 years, so thank you again, Dr. Underwood. We'll talk to you again soon.
Absolutely. Thanks.
You bet. Thank you very much, Dr. Bob Underwood. He is the Chief Medical Officer, San Juan Regional Medical Center, our guest this morning here on our KSJE Community Information Program. Are you ready for another variant?
No.
Megan Cullop, both
I'm
of us
not.
were just like, oh,
well,
please.
and like Omicron is at least like it's a cool name. I mean, it's not cool, but the name is cool.
You like the name.
But BA1 sounds like a droid.
BA2, yeah. They may come up with a better name if it becomes more newsworthy, I guess.
If it becomes the thing, we have to choose a better name. We gotta go with,
But,
and I still feel like they should go with the hurricane model, like Stu.
Right.
Like
really?
like
people's names?
Yeah, that's what they do for hurricanes.
True.
So
and winter storms. This was Winter Storm Landon, I think, that just came through.
Exactly.
Earlier in the week.
Why not COVID variant Diane?
Becky. I don't know. Okay.
I went old school. That was 1950s Diane.
Yeah. Okay.
Becky, it's more 70s.
Yeah. Right. But I don't know. But so far we're sticking with the Greek letters.
I
perhaps.
guess, except for BA1.
We'll see.
All right.
Right. We'll see what it turns out to be. But and that, I think, from what Dr. Underwood was saying, is maybe the more frustrating part for a lot of folks about just that we don't know, right? And by we, the scientists, the government, the radio people, the doctors.
The radio people.
Well, but we really, we don't know, right? We thought, well, we've got COVID. We're gonna flatten the curve in 2 weeks, and that didn't work out very well. And then here we are, and then we have Delta, and then we have Omicron, and we thought things were going to reopen this summer. We canceled the show. We were ready to go.
Yeah.
And not so soon, not so fast.
Yeah.
So the virus, I guess, determines what the virus is going to do.
Yeah.
And that's what we have known since the beginning, I guess, right?
Yeah.
This is driven by the virus.
Yeah. I mean, I'm certainly hopeful by, it's not as heavy hitting. I mean, you certainly don't want to get it still. You certainly don't want to pass it on to folks if you could avoid it. But it's great news to hear that this is not hitting us the same exact way, which is that was predicted. We do know that viruses do that they want to survive and carry. Yeah.
Usually get a little bit weaker,
Right.
When
Right.
when it mutates and changes.
Right, because you don't want to kill all your hosts, basically.
Right.
So that's how that
so
works.
as it mutates into maybe
Right.
BA1 or 2, maybe that'll be even less
Right.
lethal, we hope. But maybe more contagious. We don't know. We'll find out.
Yeah, we'll
don't-
find.
yeah,
We'll,
we're gonna find out. Here it comes.
Stay along for the ride. Okay.
Anyway, but there you go.
Yeah.
Well, let's share some more information because that's why we're here. There is
Yes.
a new schedule about testing. There's Dr. Underwood. Thank you very much for being with us. Here is the latest schedule for the Pfizer, both COVID and flu vaccine clinics, because we didn't even ask about the flu today.
Double
Right?
whammy.
But there you go. So Mondays, they're doing ages 12 plus only for COVID vaccinations, and all ages for flu vaccinations between 3:30 and 4:30. Tuesdays 3:30 to 4:30 p.m. for all ages. Again, at the San Juan County Public Health Office. Wednesdays, 3:30 to 4:30. Again, COVID vaccines for 12 plus and flu for all ages. And then Thursdays from 4:30 to 5:30. Again, COVID 12 plus and flu all ages. And again, that is over at the San Juan County Public Health Office. And you can check it out and make appointment times, vaccinenm.org. And the vaccines are still going out.
They are.
So that's a good thing.
That's a great thing.
As Dr. Underwood was saying, right? Because folks with vaccines are less likely to become hospitalized if they do get a breakthrough case of
Yeah.
COVID-19. So, also the state is reminding us about the free at-home COVID tests, right? Have you ordered yours?
I was just thinking, as Dr. Underwood was saying that, then I need to do that.
Right. There you go. Because you were getting tested pretty regularly. Are you still?
Through my occupation.
Yeah.
Yeah, but
Yeah.
I didn't have to provide them, you know.
Right.
But,
No, true.
But yeah, and that was like, nasal pharyngeal early on. That
Yes.
was
The big
big, yes.
brain poke.
Yeah, that was rough.
Yeah, right. COVIDtest.gov is the website for our radio audience who can't see the address on the screen, but that's where you can go to order your free COVID at home tests. We want to remind you about the COVID testing locations that are set up again throughout the community. Again, the newest one in Bloomfield. We talked about that 2 weeks ago. Bloomfield High School North Gym parking lot happening on Wednesdays. So again, Curative is setting up that testing site. We also have Embry that is still set up over at the Riverstone Church right there on North Monterey, kind of off of Butler Avenue there by the church. And so that's another location that is doing some drive-through COVID testing. And they are open Monday through Friday, 9 to 5. I think after the last show we did 2 weeks ago, because there was such a shortage of tests, right? I think some of these testing sites had different hours. So
Right.
I would advise people to check on the website
check on the
before
website.
they drive over there. 'Cause
Right.
maybe they're shut down.
Right.
If there's a shortage.
Right.
I think we're back. I think there isn't any shortage anymore, but I would just check. Would be
Yeah.
my advice. So
Good advice.
there you go. Some of the other testing sites, again, your favorite.
Old Tibbetts Library.
The Old Tibbetts
The Tibbetts
Library.
Rebel.
Yeah, there you go. They're
is my
Monday through
favorite.
Friday, 8 to 6. Again, that's their planned schedule.
Yes.
And so that's the Old Tibbetts Library there on East Apache Street in Farmington. Aztec Schools has a testing site.
Still, they've been, man, hats off to them.
Right?
This is long time.
Long time.
Yes.
Wednesdays and Fridays,
Yeah.
7 to 3 at Fred Cook Stadium. So again, that's a curative site that's happening. McGee Park, that's the one that's the
That's
granddaddy
also
of them
true.
all,
The
right?
granddaddy of them all.
testing
Granddaddy
sites.
McGee.
Yes.
Yes.
They have been
So
there,
true.
again, Monday through Friday, 8 a.m. to 3 p.m. Out at McGee Park. And that, I believe, is still active and still happening.
Yes.
So, yeah. So
They
they're-
deserve something at the end of this.
Right,
I don't know.
the McGee Park people that
Yes.
have been out there all this time. So yeah, so there you go. And then the Farmington Schools on 30th Street, their new kind of district office there, of course, at 3401 East 30th Street. They do their tests on Mondays, Tuesdays, and Thursdays. And so that's another site for testing.
Cool.
And so that's kind of the latest that we're aware of as far as COVID tests and such. So there you go.
There you go.
Other thoughts as we wrap up the show?
Sorry.
Now you have to clear your throat. Sorry.
I do.
That's it.
Yeah. No, I don't have any other thoughts.
Okay.
I need to, there's less, I think that we have a lot of COVID fatigue going on.
I do too.
But I think that,
Just in this room,
I think so.
there is some COVID
There's
fatigue
some
going
COVID
on.
fatigue going on. I would like to see a resurgence of like the initial COVID hope. And I don't mean that, I think there was a lot of uncertainty, there was a lot of fear, and all of that was warranted. But there was also this like thing in the air that was like, we can do this together. And that quickly fell apart, as we all witnessed and experienced. But it would be nice to go back to that. That would be my thought on COVID. I'm having a lot of early COVID nostalgia, only in the sense that there was a short period of time where we were all in it together. So,
Right.
yeah.
Right. And looking out for our fellow
Yeah,
human beings.
right. There was a lot of that.
Yeah.
So.
True. And I think a lot of the focus is kind of shifting, maybe as you were kind of talking before you came on the other this morning, about how do we, if we have to live with COVID-19, if we can't get rid of it entirely, right? How do we move forward with this becoming a maybe less lethal, less infectious, but just kind of like flu-ish, coldish a virus every winter, perhaps? And how do we live with it moving forward?
Right.
And I think some of the governments and some of the public health folks are maybe trying to look at that and what's the way forward to maybe just kind of deal with it going into the future.
I think that's the question. Yeah.
And there's a global component to this as well. I think there's a lot of concern about these other countries not as wealthy as maybe ours, where maybe the vaccine has not been widely distributed yet. I think the BBC was reporting on KSJE this morning that in some parts of Africa, it's maybe 11% fully vaccinated population.
Right.
And we know if people are going to keep traveling, and people are, that's going to, it may keep spreading until we can get the whole world somewhat vaccinated to help kind of calm things down and not have these outbreaks in certain areas.
Sure.
All right. There you go.
Yeah, there you go.
That's
a great point.
Okay,
yes.
There you are, everyone. Well, we thank you for joining us. As always, we're here every 2 weeks, every other Friday, to present whatever information is out there about COVID-19 as these variants come and go and the numbers rise and fall. We like to share that with you so that you have an idea of kind of what to watch for, what to be aware of, and how our community is responding to this challenge of COVID-19. So that's why we are here, and we're glad that you are with us as well. If the show was helpful and useful and knowledgeable, we invite you to share it with your networks on social media and other places. Tell your friends to tune in, and of course, next week, it's a different show. We'll be back with our solutions
from the street.
From the street. A new solution from
a different street, I guess.
You think it's going to be a different street? Or the same street?
Ooh. Well, what did we talk about last time? It'll be different.
Okay.
Yeah.
All right. Maybe an avenue?
I guess.
Boulevard?
Could be I love boulevards.
I bet you do, yeah.
I bet you do.
We'll see. Okay.
Yeah.
Well, there you go. But that's next week, everyone, and we'll be back with COVID-19 information in 2 weeks. So until then, thank you very much for joining us. Stay well and stay safe, and we'll see you next Friday here on KSJE. Bye-bye, everyone.
COVID-19 cases are high and it's overwhelming our healthcare system. The caregivers at San Juan Regional Medical Center need your help.
Our resources are exhausted. We're very limited on what we have the capacity to do because we're being overwhelmed with the number of individuals that are requiring ICU care at this point.
So what can you do to help? Most importantly, ignore the rhetoric and get vaccinated.
Continue hand washing, continue to wear your mask and social distance.
Help us so we can help you.